Another very common condition that we're always on the lookout for here in the dermatology office is melanoma. We see people every day for skin examinations. We're looking at existing moles and we're looking at certain features within moles to determine whether or not they are suspicious for possible cancerous moles called melanoma. Some of the features we use that you could also use at your own skin check at home would be what we call the A, B, C, D, and E's of melanoma. A stands for asymmetry, so we're looking for moles that are asymmetrical. One half doesn't match the other half. B is for border, so we're looking for a nice circular border on our moles. We don't want moles that look like stars and or have all jaggedy edges. C is for color. We like our moles to be very uniform, one color throughout. We don't like multiple different colors in our moles, reds and blacks and blues and browns. We want our moles to be very nice and evenly colored. D is diameter. So we like to think of like a pencil eraser as kind of like the size that if you get bigger than that, it is one of the features that could mean that there is something going on with that mole, that it's growing. And then D is the diameter. E is the evolving or evolution or changing of that mole. So if you've had a mole for many years and it's looked one way and all of a sudden it has evolved or changed, that is a big feature that we want to evaluate to see, is that mole changing for a reason? Is there something wrong with that mole that could be dangerous? And so we would typically recommend coming into the dermatology office maybe even once a year to have us look at areas like your back and places that you're not looking at home. But we also like people to do their own self skin checks at home so that they get to know their moles, get to know what they look like, so that we can see if they've changed over time.